Kiran, you can do 3 or 4 speaking sessions. Okay, one by one card you can send me and you can do. If nobody is coming, I'll give you more sessions.
Okay.
Yes. Yeah, you can start now.
Okay. Good morning, sir.
Good morning, nurse.
With a warm welcome, please come in and have your seat, please.
Thank you very much.
So, let me introduce myself first. My name is Kiran. I am one of registered nurses working in this community health clinic. So, for the more documentation purposes, could you please share with me your some basic information such as your name, age, and the purpose of your visit?
Yeah, my name is Matthew.
Matthew.
Okay,
Okay.
and I am here to discuss my problem with you. I am
Okay.
visiting this community health clinic today because my general practitioner is on holidays. And yeah, the other person is fully booked for the next few days. And I have been feeling unwell for the few days.
Yeah, I totally understand because your doctor is not at a dem. But if you don't mind, could you please elaborating your symptoms so I can understand your condition, gravity of your condition?
Yeah, of course, nurse. I I have been feeling unwell for a few days. Symptoms include mild fever, tiredness, nausea,
Okay.
and recent
Okay.
vomiting.
Okay, I noted down all your symptoms. So, first of all, let me examine your uh, with the physical examination. After the physical examination, and according to your symptom, I am analyzes that you are suspicious for hepatitis A virus. So, I need some relevant or important blood investigation that including liver function test because these liver function test is confirming or making a definite diagnosis for you because all these relevant information I will be presented in front of the doctor so they will be easily understanding your condition. So the sound is okay with you?
Yeah, that's really very nice, nurse.
Okay, thank you so much for allowing me. First of all, and I strongly recommended you to contact your GP on the regular basis and but in this event unexpected situation is arise so there is because of locum is fully busy fully booked for the next few days so I will be requested you to fit it in some in the see the locum as early as possible. It is okay with you?
Yeah, of course, nurse. Tell me more. What else I should do?
Yeah, actually, based on your symptom, and let me introduce before venturing into before venturing into your actual concern, let me explain you some relevant information regarding the hepatitis A. So, explanation will be provided. First of all, hepatitis A is a virus disease, and it can be spread through the contaminated food, water, and eating in dirty utensils or with the poor hygienic practice it can be spread easily. And could you please tell me your more detailing you can travel in recently you can having any history of traveling?
Actually, I traveled to, I returned from a holiday in India and I wonder
Okay.
if this could be the cause of my condition. There are some
Yeah.
symptoms include mild fever, tiredness,
Mm-hmm.
and other, nausea and vomiting. I told you, and there is yellowish tinge, and my urine is dark.
Okay, so as I'm told you, you are suspicious for the hepatitis A, but don't worry, it is very quite common in the developing country, and India is a developing country rather than the Australia. So there is a chances to get this disease easily. But don't worry, it is a curable disease. Within the few days, you have to, within the few days, your recovery is fully, you have enhancing your health status by some modification, by preventing some measures, taking some preventive measures or compliances, all the medication regimens. You, you will be definitely fine within the few weeks. So it, the sound is comfortable for you.
Yes, of course, nurse, I am fine. But the thing is, I'm concerned regarding the diagnosis. I'm a frequent traveler and I'm always careful. I took precautions in the hotels. I stayed in first class hotels, and regarding drinking bottled water only, and I avoided local food also.
Mhm. So yeah, definitely you follow all your hygienic practice and you are taking all the precautions in traveling in when you are in the India. But as I'm told you, it is a very quite common condition in the developing country. As you know that India is a developing country, so the chances of hepatitis A is very quite common. So there is nothing to be worried. As I'm told you, the modification of some lifestyle or modification some your dietary regimen is very enhancing your health status. And I will when you are seeing your GP, you can they will be advise you some medication as well as your dietary habits, so you can easily recover your condition or revert to normality. It is okay
Y-
with you?
Yeah, of course, nurse. Thank you very much for your valuable suggestions.
Okay. And lastly, I would like to tell you that the hepatitis, as I'm told you, hepatitis is a virus disease, hepatitis virus. So basically, this hepatitis A is caused jaundice. When you have jaundice when you have jaundice after a week, you the onset after a week you consider the infectious disease, and after a week you get recovery from this hepatitis A. So are you getting this point?
Yes, of course, nurse. Thank you very much. I'll follow your suggestions.
Okay. Lastly, I would like to tell you one more thing that this hepatitis A, usually duration of illness is about 1 month for the fully recovery. But when you are follow all the precautionary measures, it come earlier as possible. So I hope you are understanding all the details as I'm share you. And if
Yes,
you have any still you having any concern regarding this,
no,
so
nurse.
I am
That's
here to
everything is
provide you.
very clear.
Thank you so much. Have a nice day. And now I will be making an appointment with your GP.
Thank you very much, nurse.
Thank you so much.
Yeah. So we have noticed you're doing fine. There are some minor mistakes. Definitely, you have improved a lot, that I can tell you. But there are some minor mistakes, and there is some chaos and confusion when you're speaking. Suddenly, you feel, nervous because lack of practice. Okay. You have the
Okay.
interlocutors, Bishwant and Akhil. You can do practice with them. And yeah, you can do as many sessions as possible. Half an hour I give you. You can do half an hour with Bishwant and half an hour with Akhil. Practice. Then you come to me, then you'll have a lot of improvement, definitely. And then uh, the way how you are speaking, yeah, that's progress is clearly noticed, but that is not sufficient. And you are talking in bits and pieces. Instead of that one, the flow should come up. The confidence level has to increase. You are appearing like you are searching for words sometimes. So that flow of speech should be maintained throughout. Idea generation should happen on the spot. Okay, what next you have to speak, what next point you have to speak, everything should be very clear, and there should not be any doubt regarding that. Right. That's fine. Okay. You can send me the next card, and you can